what I'm going to do now is just talk to you a bit about what we do as GIST Cancer. We try to run the charity as best we can to support the patients. That normally starts with you realising that you've been diagnosed with a GIST because you've been told that by your oncologist. You don't know what it is, you probably Google the word GIST and hopefully GIST Cancer UK comes up. So you call us and we provide a confidential phone helpline. Marion, can you stand up? Do you mind? So Marion is one of our helpline answer people that gives you that initial advice on what to do. It's not specialist advice. It's not advice that a doctor should be telling you. It's advice really on which direction that you should take. And Marion will tell you a bit more about that during her talk, I'm sure, as well. But that would be normally your first port of call for us, other than our website. So we support you by running patient care meetings like today. So some of you, this might be your first time here. Others have come. I've seen there's some people from Scotland and quite a way away. Actually, Scotland's actually not that far away when you think about down south. This is sort of say central to that. But so we try and hold these regionally across the country. So we do one in Scotland a year and one in the north of England, one in the south of England, primarily London, although we are looking to go outside London, and we've done them in Wales as well. So that's to try and capture as many people as would want to come to a meeting without them having to incur major travel expenses. So that's the reason we do that. We also support a specialist Paul's GIST clinic. Has anybody here been to one of the Paul's GIST clinics? No? Okay, so, one. And Vicky's here, she's been. So that is something that we support that is run by the Royal Marsden in association with us. Jane Bressington runs that, if anybody's heard of Jane. She used to be a trustee. She still is heavily involved in supporting the Paul's GIST clinic. What they do there is look in detail at these very specialised GIST patients with a team of people in one place at one time. And they do around about 8 in that one day, 8 patients in that one day. And it's a couple of hours per patient. So it's individual support for those patients. One of the things that we do at these patient care meetings, we've done more and more because we found that you have asked us this, which is to share your experiences, because you will all learn from each other's experiences. So we try to give periods of our patient care meetings where you get a chance to talk to each other, move tables, speak to to people with similar conditions to you, because as we've heard a minute ago, there are lots of different types of GIST. So, and it's things like you learn how to deal with side effects of the treatment, for example. It's just a very valuable part of the journey that everybody that's on GIST has. We provide access to specialist mental health and well-being provision, provide a regular newsletter. So Cathy does Ros does our newsletter, doesn't she? Ros isn't here today. Her husband's here. Ros was ill, so she couldn't make it, unfortunately. So we sustain research and effective treatment. So we'll talk about that in a second. Tony's going to talk to you about the research side of what we do in a second, so I won't steal his thunder on that. But basically, we support research funds. That sounds quite simple. It's actually a lot more complicated than that. And then there's that influence locally, nationally, and internationally. So I'm going week after next to Washington, D.C., where the Sarcoma Patient Network are meeting. I went to Rome last year. They do Europe and America. And they bring together all sarcoma specialists and patient charities so that we can all share experiences and learn stuff that we wouldn't know about that's happening across the world, that we can then bring back and then hopefully be able to help you guys and me and us and the rest of us that are suffering. So I'm going there in 2 weeks' time, and then we're going to Miami to another sarcoma oncology specialists meeting in Miami. I'm going with Drew. because that's an even bigger one. We need 2 of us there, and we'll spend our whole time just going around talking to people, finding out what's going on in the GIST world, in the sarcoma world, to see if there's anything that we need to know that we can help bring to the table, whether there's anything that we can do to promote, let you patients know about any further anticipated trials that might be coming up, that sort of thing. I'm also a trustee of a charity called Cancer 52. Actually, they've just asked me to be vice chair, so I'm now vice chair of that charity. But Cancer 52, the 52 stands for 52% of all cancer deaths are from rare and less common cancers. We should rename it Cancer 56, but it'll cost too much money to do it, because 56% of cancer deaths are from rare and less common cancers. More people die from rare and less common cancers than they do of the top 4 cancers. So that charity is a member charity, of which GIST Cancer is a member, that supports and advocates for rare cancers at a very high governmental level. So we have meetings at governmental level. Our CEO for Cancer 52 has meetings with ministers to try and push the fact that we don't want to be forgotten. We have more incidents of rare and less common cancers than the main 4. So we want to have that proportion of money put into research, put into helping us. So that's the thrust of that charity, which I've been involved in since around 2012 as well. So work closely with related charities, that does that. Lobbying for effective treatments. As I said earlier, we're going to go to the NICE single technology appraisal to try and get further drugs agreed to be used by the NHS. And support fundraising to sustain our work. So none of us are paid a penny to do what we do. We never have been and we never will be. We all do it selfishly because we all suffer, or we have family members that suffer from cancer. It's the reason I got involved, because it means I know, I'm first-hand understand what's going on. If it comes back for me, what can I do about it? And the benefit of that is hopefully that everybody else has that same shared benefit as well. So I think I'll hand over to Tony now. If you want to give a presentation on the research side of things. Tony's our IT expert as well, but he's leaving soon, unfortunately. But we'll come to that in a minute on support that we need.
I'm leaving as a trustee. I'm not leaving the charity, so I'll continue to support. Okay, so I'm going to talk a little bit about our research program. So we've been, as Nick said, we use the money that is donated by you people and your families and the events that you run. Is this working? Can everyone hear me? Is that better? Yeah, that's better. Okay, so we use some of that money and put it into research projects. And those research projects, they can be, pretty wide-ranging. I'm going to talk about some of the work that we've funded in the last few years. Okay, so to date, GIST Cancer UK as a charity has funded just over £500,000 worth of research over the past, I'd say, probably 10 to 12 years. A number of those projects have been fairly large, so we did fund a lot of money into the trial that is still ongoing, which looks at 3 years versus 5 years imatinib. So we funded the UK part of that trial. That was about £100,000. And that trial is still ongoing, obviously, because even though we're now beyond the 5 years of treatment, obviously there's still follow-up to see what is the progression-free survival, what is the survival rate, etc. So that trial's ongoing. I think that from what I can remember, I think it's probably this year they're going to be publishing the first results from that trial, which was a European trial, which included the UK at the time. All of our past projects, you will actually find, if you go on our website, you will find there's a tab called GIST Research Papers, and that will show you all the research that we funded that is now completed. Okay, so I think there's about 6 or 7 projects on there which we've funded either fully or partially, and you can get information on each of those research projects. More recently, we've started to work with other charities and collaborate with those charities, in particular Sarcoma UK. So Sarcoma UK, and obviously GIST is a sarcoma, is actually the biggest cohort of sarcoma. It's about 20%, I think, of, yeah. So, you know, GIST is quite a large proportion of sarcomas in the UK. And we've started to collaborate with Sarcoma UK. It's a much bigger charity. They typically fund somewhere around £2 million worth of research per year. So it's significantly larger. However, they are very happy to be working with us because they see that they're getting more applications coming into them for GIST-related projects. So the way it works is that basically we will work with Sarcoma UK. We will say that we will jointly fund applications that come in that we believe are meeting, you know, the needs of GIST patients. And then we will agree on whether we're going to fund it 50-50 or 70-30, or it may be that we decide that it's something that we definitely want to have funded, so we'll fund it 100%. But it'll be managed through Sarcoma UK's process. So they use a clinical panel to assess the scientific merit and the patient value of the projects. They also use a lay panel, which is patients, and we also do the same thing. So we will basically look at the GIST applications and see whether, you know, this is something that we think is worth funding for you guys for the future. And those research projects, you know, may be that we say we want to have a project that is focusing on SDH deficient, for instance, or wild type, because there isn't any treatment today other than surgery. Or we might say that actually, no, we're interested in a project which is looking more at the mental health and well-being of patients and helping them through that journey from diagnosis right the way through to, you know, potentially palliative care. And one of the projects that we're going to fund with Sarcoma UK this year is finding a resource, an online resource that helps patients through that journey. So it's a mixture of video and online and mental health and mental well-being. And it's already operating in Australia. It's being looked at to be used in the UK and specifically modified for sarcoma and GIST. It's still fairly early stage for that, so I think we're probably not going to see it maybe for 2 or 3 years, but it's something that looks very promising from helping patients understand and navigate their way through, you know, the complexities of living or being diagnosed and then living with a GIST. Let me just, okay, I hope that's worked. Yeah. So again, on our website, we currently have 5 research grants. So there's 5 projects that we're funding, either ourselves or, as I said, in conjunction with Sarcoma UK. One of them you're going to hear about this afternoon. So Molly, over in the corner here, who works in Professor Sarah McClellan's lab, she's going to talk about chromosome instability dynamics, or CIN for short, and whether that has a significant role in GIST tumours, and actually more importantly, whether it has a role in, you know, why some people start to get resistant to certain TKIs. What role does that play? And if you understand the role that plays, then you can understand perhaps how to stop it happening, and therefore, you know, reduce the ability for these tumours to mutate and become resistant to certain drugs. So I'm not going to pretend to understand what Molly's going to talk about, because quite frankly I don't. But it was a project that we thought was definitely worth investigating. I think if you were at London, or possibly the one before that in Cardiff, then you would have heard Dr. Zoe Walters talking about the tumour microenvironment. So this is another project that we're funding in conjunction with Sarcoma UK. It's a fascinating project because it's really looking at how do these tumours interact with the other cells in your body that really should be identifying and killing the cancer cells, but they don't. And we need to understand a lot more about why these natural killer cells and why these other cells that normally would see, a tumor as a foreign body and try and deal with it itself, they don't do that for some reason. Either they're switched off or they're blind, or there's something going on with that interaction between your normal cells that would normally try and kill off the GIST cancer cells. So they're looking at why that happens, what is the interaction, and again, if you can then somehow get the natural killer cells in your body to recognize that GIST is a foreign entity and shouldn't be there, then perhaps you wouldn't need to have TKIs and anything else, because your body will be doing its job and killing it off for you. So that's another one of the projects, and there's various other elements of that. So for instance, there's a SDH or wild type GIST component of that work as well. Because the issue with the SDH deficient is that the TKIs don't work because they try and slow things down. The problem with SDH deficient is that you're actually deficient. The thing that you should have isn't there, so you can't slow it down because it doesn't exist. So that's why these TKIs don't work for SDH deficient GIST. But it's not just to do with that sort of research. We also look at imaging. So is there better ways of doing imaging so you can better understand what's going on with some of these GISTs? They may be metastatic in the liver, or they may be in the primary setting. So there's work that we funded in Cambridge looking at that as well. So, and again, all this is on our website. If you're interested in the research that we're funding, then please go to the website. What you will find is in the next couple of months, there will be another 3 projects up there, because we've just agreed to fund with Sarcoma UK another 3 projects this year. And I think Nick's going to talk about how much money is involved in a minute. But the funding that is raised by you and your families and other people who are involved with GIST Cancer UK, this is where the money goes.
Thanks, Tony. So yeah, our resources and our funding plan. So when you guys or your supporters, families say we want to donate some money to GIST Cancer, we want you to know what it is we're using that money for and how much it is collectively. So we currently spend around 100,000, and our income from donations is about 113k. So our income normally matches our expenditure, but we spent 132,000 of that 199 on research and development. Now that's money that we've already got in the bank, because, for example, a few years ago we had one of the directors of, you've all heard of Dave UK on the TV, where she was the head honcho on Dave. Very nice lady. She wanted to support us, and apparently, I've not been involved in commercial, but apparently these big commercial companies have a way of supporting social enterprise by choosing a company that they want or a charity that they want to support. She decided, because she had a GIST, that she wanted to support our charity, and they raised £80,000 for us over a period of a year. So that was a big lump sum for us, and we wanted to make sure that was spent properly, and what Tony's just described to you is some of that money went into some of those research projects. So 132k, that that's a lot of money that we spend, particularly on research and development, and we're not getting that sort of money in every year, by the way. I wish we were, but we're not. So we have to be careful about where we send that money and what we agree to, which is why we have what's called a medical advisory board. So that medical advisory board is a group of people who are experts in GIST. They will look at the projects that people come to us with. They will assess whether or not they are relevant to us, and they then send it for peer review to either America or Europe to see if they agree with them, and then we support that research project based on their decisions that they make. But us as trustees make the overall decision based on the advice we get from them. So in 2025, we've got 5 major research schemes totaling 193,000. These patient clinics for a further 2 years are going to cost us 60,000 a year. It's not cheap to run these because we have to hire the hall. We give you all lunch. We want you all to feel comfortable when you're here. Because most of you are on TKIs, we have to keep the heating up. Are you cold, anybody? I was when I first came to these and couldn't understand why until somebody said when you're on a TKI, for some reason it makes you feel cold. So, you know, it goes towards the outreach for the, as I explained earlier, the 3 times that we, over the year, try and reach out to you as patients. The tissue bank at the Royal Marsden Hospital, that's run now by the Royal Marsden, but basically when you have your tumour removed, a few years back, we set up a tissue bank. Jane Breston was very involved in doing that, and she managed to go through all the hoops and hurdles because you're dealing with human body components. And we managed to get this tissue bank, which has now gone to the Royal Marsden. Basically, if you can have a bit of your tumour removed, sent to the tissue bank, when we have researchers that want to have a bit of tissue to work on, that tissue bank is there to do that. It's been so successful, actually, that the more common tumours, the exon 11s, we got enough of them. We're after the rarer tumours. So if anybody is diagnosed with a rarer GIST, contact us because we would like to get you a little bit of your tumour over to the tissue bank so that researchers can have access to that. And we've got a process and a procedure that's all been approved by the regulatory authorities to do that. So come and see us afterwards, talk to us if any of you are in that situation, or contact us through the website on our phone number. Patient clinics, that was the Paul's GIST clinic that I referred to earlier. So that's an annual cost of about 24,000. And then you've got the unallocated reserve. So that's the money that we will use for the research projects that come in that that Tony was talking about earlier. So we don't have any expenses like a building, an office, or paid people. So that's good. That means that all the money that comes in goes to supporting GIST cancer patients. So we're one of those, maybe those rare cancer charities where, you know, you hear some of these bigger ones pay their chief executives a lot of money, and you know some people don't like that. We don't have that problem here, and we that will be the same for as long as any of us are involved in it. So that's where your money goes. And this is why we have fundraising for GIST cancer. So you know any donations will be gratefully received. At the back of the room, there's some literature, some badges. We often get people write to us and say, we're holding an event, can you send us some badges? We send them. We're not we don't have a shop, we don't sell anything. We give you these. We hope that you'll give us a donation in return, because these cost us money, as do the wristbands. Some of you got wristbands on. And other literature there, so we can help you with fundraising as well. Cathy, at the moment, when you register with us on the website and it's your first time of being diagnosed, we send you a starter pack. Has anybody received a starter pack from us of late? Good. I'm glad somebody put their hand up. So that, well, that isn't the first time I've heard that, to be fair. I'd rather that came out when you were speaking, if I'm honest, but So the starter pack is just for beginners booklet, a couple of badges and a couple of wristbands, and it just gives you a bit of an insight and oversight as to what GIST is. So we send that to every new patient as well, and they all cost money to produce. So this is where we get that, where we get the money, and that's how we spend it. So, right, Cathy or Mark, I think one or other. So Mark is going to, who's going first? Oh, okay, all right. So I'm going to take my glasses off. You're going to talk to us about our charity status.
Well, yeah, that's Mark, aren't you? Go on. Just a quick update.
Yeah, good afternoon, everyone. I'm Mark, or if you prefer in just 4 words, I am stomach, 11, probably grapefruit, and high. So my GIST cancer was in my stomach. I'm a boring common exon 11. I'm a grapefruit size when it was removed. Now this is, as you'll know, a medical technical term, and it started off when it was first analysed as a tangerine, but by the time it got into surgery, it was up to grapefruit size, and that's about me. So I'm going to just run you through where we are in relation to the charity status. At the moment, we're a charity run by the trustees, but we're in the process of becoming a charitable corporate incorporated organisation, which means that it won't change anything as far as you're concerned, but it does mean we have to change our charity number. So we are registered with the Charity Commission, we will be re-registered with the Charity Commission, but we will continue to do all the good work that Nick outlined earlier in relation to you and what we do for patients, etc. So that's about it in relation to that.
Yeah. You were going to talk about the State of the Nation survey, but you can't.
Yeah, well, the State of the Nation, some of you may have contributed to the State of the Nation survey that Sarcoma UK undertook. They are still currently analysing that. I was hoping that I might be able to say a few things about that this time, but the results of that won't be out until the end of next month. So as soon as we are able to talk a little bit more about that, we'll share that around. And that will have some things that you said about your experiences of being sarcoma patients, which you are, if you've got a GIST. So it'll feature that. It'll feature good examples of things that went really well for patients, and there are some really good examples of the treatment they had from the NHS, but there are also some areas where there are room for improvement, and they will feature in that report, which will hopefully go towards helping government policy in the future to further improve the response that GIST patients get from the NHS.
Yeah, and actually we have heard from sarcoma that quite a number of our GIST patients took part in that survey, so thank you. And I know that, Charlotte, you were really pushing that as well, weren't you? We, Mark and I, have drawn up a patient questionnaire, so I think it was done about 4 years ago. So it's time for us to redo a patient questionnaire. You will get a link to it in May, so watch out for it. We'll put it on the website. It will be on Facebook. It will take you about 10 minutes. We've asked a lot of questions, but hopefully most of it is a tick box thing. There's a couple where it just asks you a bit more information, but hopefully you'll be able to do it, and it will give us an outline for where we want to go next and what we want to do. Some of it's about patient meetings as well. Sorry, I haven't got the clicker, have I? Okay, right, just before lunch, so we've not got very long. We've got, we want you to have a round table discussion on your tables, and this might answer some of the questions that I've seen put up there, hopefully. So, on your tables, you've got some post-it notes, which you can record things on. Things that I wish I'd asked at my first meeting with my oncologist. Some of you who are new and haven't really had that process, listen to what the people around you are saying. But if you can record it in some way, and I'll put it on the board there so you can put your answers on there, and I'll capture it, and then I'll feed it back on the website. And then, what support do I want from my oncologist and specialist team? Okay, so this is over to you. It's you talking to each other, you coming up with some things, sticking them on post-it notes and putting them on the boards. Okay, thanks.